Hello, my name is Laura Reiners and I serve as the Community Relations Director at GrowthWorks. GrowthWorks is a human service nonprofit and we've been serving the Southeast Michigan community for over 50 years. We specialize in substance use treatment, juvenile justice, and family services. We want to make sure that Canton Township residents know about the services that are available to them and individuals and families in the surrounding communities. On this program, we'll invite staff from GrowthWorks and our community partners to share the work that they are doing to help restore hope, embrace change, and improve lives of the individuals that we serve. Today we have with us GrowthWorks CEO, Nick Griswold. Nick, thank you for being here with us today.
Thanks for having me, Laura.
So Nick, tell us a little bit about yourself.
Going way back, I grew up in the Upper Peninsula, moved down here in 2004, graduated from Ferris State University and came to Metro Detroit. I've worked here for over 20 years now, obviously, and came to GrowthWorks 5 years ago. I left public education. I was an assistant superintendent in a K-12 public school in Wayne County and came to GrowthWorks 5 years ago. It's been a great opportunity. Organization is really great. I have a lot of fondness for it and the people there and the work that we do.
So Nick, tell me, when was it that you first heard about GrowthWorks?
So at the school district, we were a client at GrowthWorks. So GrowthWorks provided social work services in our schools to kids that were either struggling at home or at risk. Maybe they've had police contact. We had that arrangement for the entire time I was there, and it was there long before. And so I guess, as a customer of GrowthWorks services, that's the first time I was introduced to them and their staff.
Okay. So since coming over to the GrowthWorks team, what has your journey looked like since kind of joining GrowthWorks and then becoming the GrowthWorks CEO?
Well, it's been a lot to learn. The services that we provide, I'm not a clinician by trade, and so learning what we do and how we do it has been a real challenge. The past 5 years, I still don't pretend to know it all. I like to think that I can spot good work when I see it now, and really I feel like my job is to just provide the support and the resources for our clinical staff to do their work, and so that's what I try to focus on.
So leading off of that, you talked about providing that support. I mean, what does it mean to you to be leading a human service nonprofit where we have social workers, we have other clinicians, and they're doing such important work? I mean, what does that mean to you?
That's humbling. I'm not sure I thought I'd be in this position, when I graduated from college a few years ago, and it's a responsibility that I don't take lightly. I mean, we see upwards of 2,000 clients each year, and each one of those has a story behind them, families behind them, brothers, sisters, moms, and dads. I take all that very seriously, and like I said, I think it's just my job to put the true helper healers in position to be able to work with our clients.
Gotcha. So talking a little bit more about how you came from the school district that was a partner of GrowthWorks, I mean, what does that mean for all the different partners that GrowthWorks works with in the community? I mean, we've got about a team of just under 100, but we've got countless community partners. What do those partnerships mean to GrowthWorks?
They mean everything to GrowthWorks. There's no way we could do the work that we do without the support of so many partners, whether it's the Conference of Western Wayne, Canton Township, a lot of the other governments that are in our area, the County of Wayne, State of Michigan. They all do a lot to help us, not only with the resources that we need to do the work, but really the access, the communication, the support needed. The work that we do really involves a lot of different people. We try to really surround families with a lot of help and support, and that comes from all over. And there's just no way that we could do it without the support of our partners. It means everything to us.
Well, thanks for sharing that. So you touched on it a little bit of just the different services that GrowthWorks offered, but maybe you could give us just a little bit of a history lesson in terms of just how GrowthWorks has evolved
Sure.
as an agency, just kind of how we started and then how we've continued to add to that menu of services.
Yeah, it really started as a drop-in center for kids in 1971 in Plymouth, Michigan, in the city, and it was really meant to get what everyone called those kids, some of us and some of our parents were those kids, I'm sure, out of Kellogg Park and give them something to do instead.
Okay.
And it evolved over the years from there. I think there was a recognition by the staff back then that there was more going on with kids than kids being kids. And we all know that now looking back.
Yep.
But at the time, I think that was harder to spot and what to do about it. So
Okay.
that evolved into a number of different programs, from alternative education, substance use disorder treatment, even before people really understood what that was,
Okay.
and has grown from there into what the organization is today, which is a lot of different types of work with families, kids, adults, across all spectrums of our society.
Gotcha. So just all those different programs, I mean, why is it important that an organization like GrowthWorks exists? I mean, clearly these are a lot of challenges that families and kids, adults are all struggling with. So why is it important that an organization like GrowthWorks can provide the services in the way we do?
I think what we do that might set us apart is that we try to provide a really private, high quality healthcare, behavioral healthcare experience to folks in the community that would not easily be able to access it. You know, you and I sit here today. I'm imagining that we have good health insurance coverage, and we have a support network that's available to us that,
Right.
that frankly not everyone has. And rather than just presuming that folks that don't have access to that should receive a less than service, I think GrowthWorks' mission has really been to provide that same high quality service that we would all receive, even to folks that don't have access to it and have access to our system instead. And we try to do that in a way that's low or no cost to most all of our clients.
Gotcha. So GrowthWorks, like we said, has had a long history, has been around for over 50 years, but I think GrowthWorks continues to evolve, and that's what's made us the organization that we are today. So I know there are a lot of exciting things going on at GrowthWorks. One of the things that we're doing is a partnership with St. Mary Mercy Hospital and some other local organizations around suicide prevention. We've actually hired a staff member recently to be doing some work with some local school districts. So maybe you could talk just a little bit about that and the work we're doing around suicide prevention.
Yeah, it's a real exciting opportunity for us, I think, to sort of be at the center and help coordinate an effort between, there's 7 partner school districts along with the hospital and many of the the city and township governments that are in those areas. It represents about 65,000 students and upwards of 10,000
Wow.
employees that make up this cohort of those 7 districts. And they've really set a goal for themselves for 0 youth suicide. And that's a lofty goal. It's hard to believe, but suicide is the 3rd leading cause of death among adolescents 15 to 19 years old, right behind homicide, which is maybe even more sad, and accidents is number 1. And so it's an issue that's really important. It's an issue that personally is really close to my heart, and I think that drives us in our effort to I kind of be the tie that binds between those 7 school districts and really be that force multiplier that provides the power necessary to tackle such a complicated, difficult, it's hard to talk about issue, and really bring it to the forefront and do something about it.
So you touched on it just a little bit there. A lot of the topics, or a lot of the programs that GrowthWorks offers, they kind of come out of these very difficult issues, kind of the uncomfortable things we don't always like to talk about. There's a lot of stigma around some of the things GrowthWorks deals with it. How do you find a way to kind of break that stigma, whether it's with our staff members or people that may not know about GrowthWorks and the services we offer? What is GrowthWorks doing to help break down that stigma around some of these issues?
I think thankfully that conversation is easier to have maybe in 2022 than it has been historically for the organization. You know, you see a lot more coverage in media, a lot more conversation, I think, even amongst families and with local governments about mental health in families, mental health of kids, just being a kid in 2022 and all that entails. I think that's what really makes it a little easier to talk about. We're not completely there yet, and I don't know that we'll ever be, but it's certainly easier to have that conversation. I think for us, what we really try to do is really disarm the shame that people feel directly or indirectly about talking about those topics. It can be really hard things to talk about, and we just try to immediately eliminate the shame that folks are feeling, and know that they don't have to feel shameful in front of us, that we'll give them a lot of grace and understanding and support. And in a lot of cases, they're going to interact with a staff member who's walked the same walk that they're on now, and there's no better way to provide understanding, I think, to a client than to have them see someone who knows what it's like to be them.
Exactly. So as we sit here in Canton Township, maybe you can just elaborate a little bit more on how GrowthWorks works specifically with Canton Township. We're fortunate to serve a number of different communities, but talk a little bit just about our relationship with Canton Township.
Yeah, Canton Township's been a really great partner for our organization. I think we've been a great partner to them too. Programmatically, we help operate the Canton Human Service Center, which houses us and a lot of our treatment programming, but also wonderful organizations like Canton Community Foundation, Habitat for Humanity, and others. And that's a great little resource that Canton Township has put together that you don't see necessarily in a lot of other communities. I would say too that Canton Township's a great partner because whenever we have a innovative, interesting idea, Canton Township is almost always immediately on board to listen and help us figure out how to implement. And we try to do the same thing with them. And I think that's why a lot of our innovation in our treatment, and in particular our work with kids, comes from Canton Township. A lot of times we start pilot programs or phases of pilot programs here, and because we know we have such a strong community and such a good working relationship with the folks that help us.
Can you speak a little bit more on one of those pilot programs, just
Sure.
kind of maybe how we see Canton as that innovation center and how they've helped us come up with new ways to serve the community?
Yeah, so like a great example of that is the youth diversion program that the police department, we helped them organize and structure that, and then we provide the service to kids. So kids that are come into police contact, rather than having a complaint sent downtown and be adjudicated formally through the court, can go to GrowthWorks in a matter of days and receive services directly from the police department. That's a process that sometimes can take 30, 60, 90 days to happen if you go through a formal adjudication process. And anybody that has kids know that the intervening measures, the consequence, if you will, at times, needs to immediately follow the action if they're going to make any difference. You know, I can tell my daughter 6 months ago that she should have cleaned her room 6 months ago, and she's not going to even remember that happened or why we're having this conversation now. And the same goes true with all kids. And I think that's something that's been really helpful here. We've had a lot of kids pass through that program, and ultimately, too, been able to avoid a lot of the more significant consequences that come along with being formally part of the juvenile justice program.
We've been very fortunate in the history that we've had so far. I mean, it's been 50 years, and there have been a lot of changes that have happened. I mean, even just in your time at GrowthWorks and my time at GrowthWorks, it's continued to evolve. What does GrowthWorks look like 5 years from now?
I think the next 5 years will be a bit of a transformative time for us, certainly a challenging time. There's excitement in that, not excitement for maybe the challenges that everyone's facing, but that we have an opportunity to be there to help. So I think that what you'll see from us in the next 5 years, let's say, is just a really branching out in services, trying to be more useful to more members of our community than maybe we are today. We're a growing agency. We're trying to grow as quickly but as efficiently and effectively as possible. But our goal is to be there for the community. I think that's what's kept us going 51, 52 years now, is just this idea that what are the needs of folks in the community, and how can we step up and meet that moment.
Gotcha. So if anybody knows of somebody who's struggling with one of the challenges that GrowthWorks works to support, whether it's substance use, having an adolescent or a child who's struggling with some behavioral issues, what would be your advice to that family member or even potentially that future client?
Seek help. Pick up the phone and call. Call us. There's a lot of other great organizations in the area that I didn't know about before I even came to GrowthWorks that are there to help. I think what you'll find, particularly at GrowthWorks, is a lot of grace, a lot of understanding. Like I said before, you'll often be talking with someone who's walked the walk that you're now on, whether you're a parent that's struggling with a family relationship or kids or whoever it is. Our folks come to us as staff members for a reason, and usually that reason is born out of something that's occurred to them in their lives, and there's a great deal of humility in that, and just a great sense of caring and want to be helpful in that. So I would say pick up the phone. It's not scary, it may seem scary, but we've been there. We've literally heard it all before.
What would be a final message that you would want to share with our viewers today?
I think just just a thank you to a lot of the communities and partners that we're involved in. It's been a true blessing to be involved in the community for as long as we have. You know, as far as our organization, the future looks as bright as it's ever been. So I absolutely expect that we'll be around 50 more years and well beyond that. And stop by and see us. You know, stop by and say hello, see us. We're at a lot of community events. We have a lot of partnerships that extend even beyond you know, our behavioral health care community. Yep. Come and say hello and get to know us.
So thank you, Nick. So thank you for joining us today to learn more about GrowthWorks. You can find us at gwcares.org or follow us on one of our social media channels, including Instagram, Facebook, and on YouTube. So thank you for joining us today, and we look forward to seeing you in the future for future GrowthWorks programming.